everyone. So in our last video we treated condition known as cholera. We looked at the overview, the signs and symptoms, the management. So today we're going to be looking at a brand new topic, a whole different topic, and this is known as eclampsia. So eclampsia is a serious life-threatening complication of pregnancy, and it is usually defined by the occurrence of generalized tonic-clonic seizures, that is convulsions in a pregnant woman who already has signs of preeclampsia, characterized by high blood pressure and protein in the urine. So eclampsia can happen during pregnancy, during labor, or after delivery, that is postpartum. So it is usually a medical emergency that requires immediate intervention to protect both the mother and the baby. So looking at the background, the name eclampsia originates from a Greek word meaning a flash of light. So it's this might reflect the sudden and dramatic appearance of seizures, and historically is one of the leading causes of maternal and fetal deaths, especially before the creation of modern prenatal care. So eclampsia is considered the final stage of a disease spectrum that begins with gestational hypertension, progresses to preeclampsia, and if left untreated or if poorly managed, it results in eclampsia. So while preeclampsia affects about 5 to 10% of pregnancies, eclampsia occurs in only about 0.5 to 0.7% of all pregnancies in modern healthcare settings. So however, in areas with limited access to antenatal care, the rates can be much higher. So when we're looking at the signs and symptoms of this eclampsia, so the main sign of eclampsia is the presence of these seizures, but there are other warning signs that might often precede it. So this may include persistent and severe headaches that are usually not relieved by painkillers. Then visual disturbances such as having blurred vision, double vision, or seeing flashing lights. Then epigastric pain, that is pain in the upper right part of the abdomen, which is often mistaken for indigestion. Then there's also swelling of the face and hands due to fluid retention. Then there could be sudden excessive weight gain, nausea, vomiting, reduced urine output, high blood pressure, and irritability. So the seizures themselves, they are typically tonic-clonic, that is stiffening followed by jerking movements. Then they last about 60 to 90 seconds, and they are followed by confusion or drowsiness. So looking at the clinical presentations, eclampsia may present suddenly without warning, but in many cases the woman has signs of worsening preeclampsia in the days or hours leading up to the seizure. So it's like a hierarchy before you get to the final stage where it is very severe. So the pregnant woman or the patient, she may be in her third trimester of pregnancy. That is, third trimester is usually after 28 weeks, although it can occur in the second trimester or even up to 6 weeks after delivery. So the pregnant woman can report a severe headache, and she can also report that she's having visual disturbances like flashing lights and all that. Then her blood pressure readings are usually very high, sometimes above 160 for systolic and 110 for the diastolic. So, and the patient might also appear anxious, agitated, or confused before seizing. So sometimes the seizure may be the first and only sign, especially in settings with poor prenatal care. So sometimes there might not be any of these other symptoms. The seizure might just happen like that. So looking at the cause of this eclampsia, so the exact cause of eclampsia is not completely understood. However, it's believed to be due to number one, abnormal placental development in early pregnancy, then also due to reduced blood flow to the placenta, then imbalance of androgenic factors, that is the chemicals that control blood vessel formation, then systemic endothelial dysfunction, that is the lining of the blood vessels is damaged, then increased vascular permeability leading to swelling and inflammation. So these different changes, they can cause the high blood pressure, they can cause the fluid retention, they can cause organ dysfunction, which then lead to the seizures if they become severe. So looking at the risk factors, certain women are more likely to develop preeclampsia and eclampsia. So first, that is if the the first risk factor is if this is the woman's first pregnancy. Then if the woman is between the age of less than 20 or more than 35, then if it's a twin or triplet pregnancy, that pregnancy is always a high risk pregnancy. Then if there is a history of preeclampsia that she had in the previous pregnancy, then also having a family history of eclampsia, then also having pre-existing high blood pressure, because this is what we see in cases with preeclampsia, then obesity, having chronic kidney disease, diabetes too, and some autoimmune disease like systemic lupus is also a risk factor. So looking at the anatomy and the physiology of pregnancy, the placenta develops new blood vessels to supply oxygen and nutrients to the growing baby. So in women who develop preeclampsia and eclampsia, the blood vessels are abnormally narrow, leading to poor blood flow. This poor blood flow leads to placenta hypoxia, that is low oxygen, which then triggers the release of harmful substances into the mother's bloodstream. So these harmful substances, they can damage the endothelial cells, and these endothelial cells are cells that lining the blood vessels. So they can damage the endothelial cells and result in widespread inflammation, and also results in high blood pressure and organ dysfunction, particularly in the brain, in the liver, in the kidneys, and in the eyes. So first, we have the blood vessels, which are abnormally narrow, which will cause poor blood flow. So this then causes placenta hypoxia, that is low oxygen. Then this placenta hypoxia will now trigger the release of harmful substances into the mother's bloodstream. So these harmful substances, they damage the epithelial cells, as the cells lining the blood vessels, and cause widespread inflammation, cause all the symptoms of both preeclampsia and eclampsia. So for the pathophysiology, first, we have abnormal placenta. Abnormal placenta leads to reduced blood flow to fetus and mother. Then that is number one. Then number two, the placenta releases inflammatory substances into the mother's blood. Then number three, the widespread blood vessel injury occurs. Then number four, there is increased blood pressure and leakage of fluids from the vessels. Then number 5, we see organ dysfunction like brain swelling, kidney damage, liver issues, then cerebral edema and changes in the blood flow, then eventually leads to seizures. So that's basically the breakdown of this eclampsia and preeclampsia. So looking at the diagnosis is usually clinical based on symptoms and physical examination. So it includes blood pressure measurements, that is sustained readings above 140 to 90 mmHg, then urine analysis with having proteinuria, that's the presence of protein in the urine, then blood tests like having elevated liver enzymes, kidney function tests, platelet counts, having low platelet counts, then seizure history like in a pregnant woman who has had a previous seizure, or postpartum woman without epilepsy, then fetal monitoring too to assess the baby's well-being. Then looking at differential diagnosis, so doctors they must consider other causes of seizures in pregnancy, like for example epilepsy, then brain hemorrhage or stroke, meningitis or encephalitis, that is having brain infection, then also low blood sugar too, drug toxicity, or probably brain tumor. So these are the other causes of seizures in pregnancy that the doctor must also consider. So looking at the management or the approach considerations, so number 1, immediate stabilization. So first we have to ensure the airway is clear to prevent aspiration. So we place the woman on her left side to improve blood flow to the fetus, and then we administer an oxygen mask. Then we monitor for vital signs and for the fetal heart rate. So after the immediate first aid stabilization, then we go to seizure control. So to control the seizure, we can use magnesium sulfate. So this is the gold standard medication to prevent and treat seizures in pregnancy, and it is preferred over other drugs because it prevents the reoccurrence of these seizures. So the dosing must be carefully monitored to avoid toxicity. Then to control, so the management considerations are, we break it down into: first, immediate stabilization; then 2, the seizure control with magnesium sulfate; then 3, control of the blood pressure, so using fast acting blood pressure lowering medications like labetalol or hydralazine. So the goal is to reduce the blood pressure gradually to avoid reduced blood flow to the baby. Then the 4th step is plan for delivery. So once the mother has been stabilized, delivery is the only definitive cure. So the mode of delivery, that is vaginal delivery or cesarean, depends on the mother and the baby's condition, and also it depends on the gestational age and the presence of labor. So in some cases, delivery has to be done immediately regardless of the gestational age. Then for the last step after the plan of delivery, then we have the post-seizure care. So we continue with the magnesium sulfate infusion for at least 24 hours after the last seizure. Then monitor urine output, reflexes, breathing, and also monitor the blood pressure very closely. So looking at the prognosis of this condition known as eclampsia in pregnancy, so with early detection and treatment, outcomes are generally good. So for the mother, when we're looking at the mother's perspective now, the risk of stroke, kidney failure, pulmonary edema, and death is possible if not treated quickly. Then full recovery is possible if the condition is managed early. Then there can be future risk of high blood pressure and preeclampsia in the later pregnancies. So like I said, the risk factor is having a previous history of this preeclampsia already. Then when we are looking at the baby now, in the case of the baby may be born prematurely, or there could be risk of low birth weight, growth restriction, or even stillbirth. And then close monitoring of during the pregnancy often improves outcomes. So that is basically the breakdown of this condition known as eclampsia. So thank you.